Good afternoon to all. Now let us discuss about the design thinking based remote patient health monitoring system. See, remote patient health monitoring system plays a vital role in signals and systems to collect, transmit and analyze the psychological data of patients in remote areas. By integrating the wireless sensors or real-time monitoring system, communication systems, remote health monitoring systems plays a vital signs in heart rate, blood pressure and oxygen level, body temperature and ECG levels. See, now let us discuss about the design thinking based remote patient health monitoring system. Design thinking is an efficient and reliable system focusing on user needs. It is of 5 stages: empathy, define, ideate, prototype and testing. Let us discuss briefly.
So I am going to talk about empathy. In this design thinking process, the first step is in order to include the users, namely patients, doctors and healthcare providers. So for patients require a constant monitoring system without any discomfort, and doctors require real-time data which can be utilized in order to provide accurate decision. So in signals and system wise, it is an important phase which is utilized in order to get physiological signals for ECG for heart patients and blood sugar level count for glucose patients. Understanding challenges including sensor discomfort, battery life and network reliabilities. These are all included before designing a system in order to provide a perfect system which provides a user-friendly interface and technical robust.
Hello all, I am going to explain about the define phase. In this stage, the key problems are clearly defined, such as delayed in detection of the healthcare abnormalities, lack of real-time monitoring and the limited access to the healthcare infrastructure in the remote areas. Based on these challenges, the system requirements are established, where this includes defining the type of sensors that we needed, and then the sampling rates for the signal acquisition and the noise reduction techniques and the system reliability. From the signals and systems viewpoint, emphasis is placed on important role on defining the input signals where it is a physiological signal. System models such as filters, controllers and amplifiers. And we also decide outputs are noted where it should be clean and the interpretable health parameters should be there. This structured definition ensures that it is reliable and the system meets the medical availability and accuracy.
By integrating the real-time patient health monitoring system in remote areas, plays a vital role in analyzing only with the help of digital signals. With the help of digital signal means we are using it as your sampling. Sampling is nothing but a process of conversion of analog signals into digital signals. With the help of that is nothing but analog to digital converter. And also we are going to analyzing with the help of by using transforms, Fourier transform or fast Fourier transform. See, Fourier transform is an efficient way to analyze the real-time patient health monitoring system. How it is means it provides a reversible transformation link between the time domain and the frequency domain. From the time domain signals that can be converted into frequency domain. How they are analyzing in terms of frequency domains is with the help of filters. By using IAR filter, FIR filter. Based on this IAR, FIR filter, we are going to define low pass filter, high pass filter, band pass filter or band stop filter. By integrating all these signals into real-time monitoring system, we can analyze the psychological data into useful information data.
So next phase is ideate phase. During the ideate phase, multiple solutions are proposed to improve the monitoring systems. The concepts such as adaptive filtering for noise cancellation, signal amplification, analog to digital conversion and feature extractions are designed. Control system concepts are applied to maintain the system stability and real-time data transmission, and also ensures that consistent data transmission. This phase focuses on transforming the raw physiological data into the meaningful health indicators by using digital data processing systems such as fast Fourier transformation and pattern recognition.
Hello all, I am going to talk about prototype. In this prototyping stage, a functional model of the remote monitoring system is developed. In this, wearable or implantable sensors act as the signal units that capture physiological stages. These signals pass through the signal circuiting systems that includes amplifiers and filters to remove unwanted noise. Wireless communication models such as Bluetooth, Wi-Fi, cellular networks or to transmit signals to healthcare systems. Cellular networks is nothing but 3G, 4G and 5G. This stage validates the interaction between subsystems such as sensors, signal processor, control units and communication blocks, which acts as a smooth data flow, and it acts as a Bluetooth transmission to enhance the system reliability.
So the last stage of design thinking is the testing phase. In the testing phase, it is evaluated in the real world applications to test the accuracy, reliability, latency and the user comfort. So the system metrics, performance metrics such as signal to noise ratio, delay, bandwidth usage and the errors are analyzed. And we also collect the feedbacks from the patients and healthcare professionals. So which helps us to improve and alignment for the users. So coming to the conclusion. In the conclusion, the design thinking provided a structured and a human-centric approach to develop a remote patient healthcare monitoring system. By focusing on the user needs, precise system, iterative testing, innovative signal processing, the system becomes an accurate, reliable and scalable one. This system plays a vital role in the modern healthcare technology by bridging the gap between the patients and the healthcare providers.
The integration of all these design thinking framework into psychological signal processing systems and communication technologies enable real-time health monitoring, early detection of medical conditions and improve the patient outcomes. It plays a vital role in modern healthcare by bridging the gap between the patients and the healthcare providers, especially in remote areas. Thank you all.